once I've cleaned the cage and done the first spray with the general purpose cleaner, I'll go ahead and disinfect the cage with a Safe 4 or equivalent disinfectant with this is diluted at a rate of 1 to 100 for bacteria and other for cages and walls and floors. I'll go ahead and spray that in there. This will need to sit for 30 minutes and then I'll go ahead and use the general cleaner again to remove any disinfectant. Now that it's sat for 30 minutes, I'll go ahead and use the general purpose cleaner and wipe it off. And then I'll go ahead and reset the patient's cage. And place the enrichment toy in there for them. Once I've cleaned the cage, I've removed my PP and disposed of them into the general waste along with the paper towel. It's important to know when to put clinical and general waste into those specific bins. Clinical waste is anything to do that could contract to another patient or human, so any poo, wee, blood, body parts, anything clinical, anything with blood on it will go into the clinical waste so that there's no risk of contaminating other areas or people or dogs or cats or whatever the deal is. And then general waste would just be your non-contaminated waste, such as paper towel, gloves, masks, whatever you used on yourself or that hasn't been in contact with any diseases such as parvovirus go into that bin. And then once we've put all of our PP in the bin, we go ahead and wash our hands or apply a hand sanitizer. This is important so that we're not contracting anything to other patients if their immune system's compromised, or we don't want to risk taking that to a different patient, or if they're puppies and not vaccinated, that such a thing. Once you've washed your hands and hand sanitized, it's important to use a dermal moisturizer so that your hands don't get cracked from the amount of hand washing that gets done in a vet clinic. If they do get cracked, there's a chance that bacteria can get in those cracks and cause you further problems.